Hello, everyone. Good evening. So, April is Stress Awareness Month, and I wanted to take some time to talk about how um, stress is linked to our physical health. So, stress, as we know, is the number one cause of disease and illnesses in our bodies. We all have a different definition of stress, and probably some of the most common stressors are physical stress, emotional stress, and mental stress. Just like stress is different for everyone, the way we deal with stress is also different. So, what is stress and why do we stress so much? So, I heard the saying before that stress comes from us making things more important than they really are. Well, some things I should say. And the truth is, I think I heard Tony Robbins say we spend a lot of times majoring in minor things. The things that we stress about, they happen because we attach some kind of meaning to it. So just in understanding that, in recognizing that that even gives us some comfort in the fact that we can manage it if we recognize what we're doing, some of our tendencies. Stress is unavoidable, and basically almost anything can cause stress. It shows up differently for each of us, and the truth of the matter is there's some stressors we cannot avoid, but the ones that we can prevent or control are the ones that we should, actively try to manage for ourselves. But how do we do that? Sometimes we don't even know. Hi, Angela. Thank you for being here. Sometimes we don't even know that we're stressed. I was like that. It would take me getting sick for me to acknowledge that I'm under a lot of stress. And I'm going to talk about that because I actually did some research, and it was so insightful because the the three types of stressors that I'm going to point out to you or I have been in those three stages. But before we get there, the key is to identify your sources of stress, right? Identify what are the things that trigger you. What are the stressors, the triggers in your life, and figure out a way to avoid them or, lower their impact in your life. Sometimes we do create our own stress because of our habits, the way we think, the way we feel, our experiences, and that can be harmful, especially if we don't have an effective way of dealing with those stress. Hi, Dr. TT. So, especially if we don't have an effective way of dealing with those stressors, right? So we can define stress as something like a situation or an emotion that comes up when when we feel like we don't have support or the resources to meet those demands in our life, right? Like we have so much going on, but we have no help. And this is what I was talking about. So I did some research. I looked into APA, American Psychological Association, and they identified 3 different types of stress. And they can also be categorized as physical, chemical, or psychological. So the physical stress is more like you go through some kind of trauma, you hurt, you fall. That's part of the physical stress. The chemical stress is like viruses, bacteria, you get processed food, you get, medication. That could be a form of chemical stress. Psychological could be anything that you're dealing with on an emotional level, like a loss, grief, negative thinking, where you are in life, maybe, well, like finances, something like that. That could play into our psychological stress. But all of those things, they put our mind and our bodies out of balance, right? This is why we stress, because we assign meaning to these things. And it's okay. I mean, like, it's a natural part of life. But as I'm saying, recommending, I should say, as we go through this, we'll just learn ways to cope effectively. So we're going to talk about the 3 types of stress that I researched with. So there's the acute, the it's called episodic acute stress and chronic. So acute, episodic, acute, and chronic stress. So acute stress is anything that's short term. That could be related to negative thinking, thinking about something that's happened or about to happen. But it usually goes away once that event or that, thought, once that event is, you overcome that event. And the signs of that could be like headache, you could have sweaty palms, you're nervous, you have a rapid heartbeat, dizziness, shortness of breath. I'll give you an example. In the military, we had to take a PT test every 6 months. And every time I had to take a PT test, I would have to use the bathroom. I would get nervous. My palms would get sweaty. And I would literally have a shortness of breath. Luckily, I had my inhaler, so I would take that. But after I take the PT test, all of that goes away, right? So that's an example of the acute short-term stress. Episodic acute stress. So some of the same signs and symptoms as the acute stress will show up here. However, this stress it leads to more issues like digestive issues and getting sicker. Okay, so as with the acute or short-term stress, the episodic stress is a person that's experiencing this. It's like their life is always in chaos. They're always in crisis. They always feel like they're in a rush. They always feel pressure, like they're pressure to do everything. They take on too much. They struggle with time management. Like right now, I'm talking about myself and have trouble staying organized, right? And like I said, I recognize some of my tendencies as I was going through reading these types of stressors. These are usually your type A personalities and your individual that worries a lot. The type A personalities, for those individuals, they are more likely to suffer, or they're more at risk to get coronary heart disease. And the worrier, this person, they always see just everything in a negative light. Everything is a disaster. They tend to be overly anxious, more depressed, and this is where they induce more physical and mental stress on themselves. Just like acute stress, they'll have some of the same symptoms, but they have an ongoing, they're suffering more mentally, emotionally. They suffer from mental fatigue, more defined health issues like that affects their digestive system, IBS, irritable bowel syndrome, Crohn's, colitis, which is where I was at one point, high blood pressure, heart disease, and somebody that's experiencing this type of stress, they won't think they need help, right? And they often seek help when the situation gets out of hand, when it gets too much for them to handle. So the last one is chronic stress. And this one is the most harmful because this one damages not just your mental health, but your physical health, and it shuts down your immune systems. So some examples of chronic stress are any kinds of abuse, repeated abuse, emotional, physical, any kind of abuse. It could be a dysfunctional family dynamic. Yes, we all have that, but there's degrees to that as well. Substance abuse, maybe you're in a relationship where you're not happy or it's unhealthy. This kind of stress can also come from traumatic childhood experiences or just any even current experience, traumatic experiences. So it shows up, some of the symptoms shows up the same way as the acute and the episodic stress. I said I was going to call that EAS, episodic stress, but it's more severe, and it often leads to mental and physical breakdown. And what that can lead to is violence, psychotic episodes, heart attacks, and even suicide. The worst part about chronic stress is that some people get so used to it that they don't even realize that they're stressed chronically until they have some kind of breakdown. So, how does stress affect our health? We touched on it a little bit, with the sweaty palms, just, we can have digestive issues, heart problems. But there are some more ways that you can recognize stress in your body, even if you are a person that can function in a high stress environment. Like I said, it show up as digestive issues, but it can also show up as migraines. It can show up as headaches, insomnia, lack of sleep. Shows up as different forms of diseases like cancer. You can also have heart attack and stroke. Another way that it shows up, especially for myself, is tension. I usually get tension in my neck or in my back. So those are some ways you can identify, the stress if you're having stress, especially if you can function in high stress environments. So before I go, I want to leave you with some techniques that you can use to manage stress, especially in acute situations. I know a lot of these we already know, but getting the reminder in just, being, like I said, just being reminded of the stressors and how to deal with them is always good. And maybe you'll remember these tips and practice them. So some techniques, some of these I've used: count to 10 before speaking or reacting. Take slow breaths, few slow breaths, just until your body calms down. You can even go for a walk, even if it's just to leave the room. Engage in a quick prayer or a meditation. I've done that before. Walking away is always good. Just going for maybe a longer walk if you have the time. Listen to something inspirational or read a book. Working out or engaging in some kind of physical activity is always a good stress relief. Getting more sleep. This is one area I know that a lot of people struggle with. Even myself, my clients struggle with it, but just keep working. Just to get more sleep is just something we have to work on. Slowing down. This is an area that I also had to learn to do, is just to slow down, make more connections. Whether that be friends and family, or just even take some time with yourself to connect with yourself. Learn what are my triggers, or trying to understand why did that trigger me, a specific event trigger me. And lean into things that you absolutely cannot change. Sometimes we're trying to change things that we really have no control over. And just that itself causes undue stress, so just those are some simple things, steps that you can do, or things that you can do to kind of come back or relieve yourself from stress. So we talked about stress and how it can affect our physical health, but the key to better managing stress is to really recognize your triggers, not assign meaning to them, and lean into the things that you cannot control. So remember, this is one of the things I've been learning. I have awesome coaches. One of them is online right now, which she made me nervous, but it's okay. I got through it. So remember, your energy flows where your focus grows. And I'm learning to lean into that. I'm learning to understand it a little bit more and more every day as I'm trying to, just better manage my stress and just live a healthier life. Just to focus on healthy living is going to take making a decision to do so. I was listening to Tony Robbins, and he says at some point we must become unreasonable with our expectations. And I love that quote, and because, like, especially in this case when we're talking about health, if we're we have to make it a must and not a should. So many times we talk about, I should eat better, I should work out, I should do this, I should do that. And he says, a lot of times people just shoulda all over themselves. So, but my encouragement to you is just to understand that stress is everywhere, but we just have to learn how to cope and manage our behaviors in stressful situations. Remember, just recognize your triggers. Do not try not to assign meaning to everything, and lean into the things that you cannot control. So thank you, everyone. Hi, Latanya. Thank you so much for joining me tonight, and I will be here again next week. Have a good night.